Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
And welcome back, everybody. We have our St. Vincent doctor, Dr. Dubbaka, here to tell us more about panic attacks in the elderly today. And it's something we certainly hope doesn't happen, but it is a possibility, and that's why we want to talk to Dr. Dubbaka. Thanks for coming in. Really appreciate it. Great to see you again.
Good morning, dear viewers. I'm glad to be here, as always.
We're glad that you're here. Let's talk about panic attacks in the elderly. And I know that's something that you don't want to see, but it does happen. Talk about some of the causes of that and how it comes about.
Yes, by definition, panic attacks are these isolated episodes wherein the symptoms feel like almost people feel like they're going to die.
Yeah.
And it might constitute them having chest pain, breathlessness, abdominal cramps, shortness of breath, and it typically spikes in about 10 minutes, reaches a peak, and most of the time by an hour it's all gone.
Really?
And people almost feel like they have a sense of doom and impending danger.
Is there any real danger then if you have that feeling?
That is what is the most distinctive feature of panic attacks. They have all these symptoms, but ultimately there is no physical danger.
Really?
And this is not a somatic disease. It is all in their head. But the important thing is we have to make sure it's not anything physical, though. This is a diagnosis of exclusion.
So just subtle things, maybe like you said, all those little symptoms that really are ordinary pains that we all go through as human beings. What do you think causes it to elevate so much in the elderly to where they get worried about it being death?
Right, especially the elderly are more prone, and that's because of there's classic theory about inheritance. It runs in the families. They might have family history, but also elderly end up having a change in their social situation.
Okay.
They might have close family and friends who might have passed away. So
due to more serious things, like if their arm hurts, their left arm hurts, they think, or they cramps in their chest.
Yes.
Okay.
There's coexisting depression in a lot of elderly, so that makes them more prone for panic attacks. And sure enough, they do have medical problems. They have a lot of heart disease, breathing problems. COPD is so much more prevalent, and anxiety and panic attacks are more common in those situations with the medical background of that sort.
You mentioned depression. Is there a link between depression and panic attacks medically?
There is. Depression is kind of in the background for a lot of anxiety spectrum disorders, and anxiety spectrum disorders themselves range from panic attacks to generalized anxiety disorder, OCD, we've all heard of that. They all range across the spectrum, but panic attacks are unique in the sense they don't last very long. They are brief episodes and not in the face of any physical danger.
Well, how do you convince someone of that who's going through a panic attack at the time that has that feeling of dying almost sometimes? How do you ease them out of that to make sure that they know they're going to be okay?
It's not very uncommon for me to see those situations in the ER, and a lot of times reassuring them helps. But also, like I said, it's a diagnosis of exclusion, so we work them up. We put them through some blood work, and of course after a thorough history and physical exam. And there are medications like benzodiazepines. These are some medications which are very strong. They're effective almost instantaneously, so that helps them calm down, and in the meantime we explain them the prognosis and come up with a plan, and that usually settles them down.
Main thing is to remain calm. Immediate thing, if someone's there having a panic attack, would you hand them like a paper bag to breathe in and out of? You see that's a popular thing.
The paper bag theory has been around for a long time, and we still use it. And basically these folks start hyperventilating, so they're breathing in and out faster. So we need to blow off that CO2. So having them breathe into paper bag helps. And I have come across theories that it's only placebo.
Sure.
And if someone is truly short of oxygen, you don't want to do that because you're depriving them of that essential oxygen.
Yeah, that's a good point. So make sure they're not short of oxygen. But almost the same thing, isn't a panic attack kind of a placebo at the same time in terms of a fake feeling of dying?
Well, I wouldn't call it placebo. This
Okay.
for the people that are experiencing it, it's almost
very real. Okay.
Yeah,
All
yeah.
right.
And like I said, it needs to be evaluated.
Okay.
It is something that needs medical attention.
And if you do need that medical attention, you can always contact the Longevity Center at St. Vincent. The number's on your screen. If you'd like to make an appointment, go free and do so. 501-552-4777. Doctor, thanks so much for coming in today.
Thank you very much,
Appreciate
Chris.
it. Thank you.